It's been a really long day with a lot of learning and insights. Okay, so we heard from a lot of nice speakers, and now is the time to hear from our participants. So we will now begin with our paper presentation session. I am honored to introduce to you our chairperson for this session, Dr. Anuradha Bakshi. But just mention what makes her most suited to chair this session of paper presentations is her experience in being chief editor earlier, now consulting editor of the British Journal of Guidance and Counselling, where she works very closely with scholars from multiple countries in her role as editor. So we are indeed privileged to have you, Dr. Bakshi, and we look forward to your valuable contribution to this paper presentation session. Refrain from social formalities during your presentation and use your time effectively to present your research. Your names and affiliation will be announced before you present. And I will announce the name of the person who is going to present, but you can always look up your abstracts on the group and you can see the other authors also of the paper. Thank you so much for understanding. So we will now begin with the presentations. I would like to invite our first presenter, Amruta B. Joshi, an MPhil student in Psychiatric Social Work from the Institute of Psychiatry and Human Behavior, Bamboli, Goa.
My research paper topic is Animal Assisted Therapy, Innovative Practices in Promoting Mental Health. Objective of the study: to study the impact of animal assisted therapy in mental well-being, to review the case studies of use of animal assisted therapy in promoting mental health, to suggest the strategy to use animal assisted therapy in social work intervention. Methodology: present research paper has been developed using secondary data published in PubMed, Google, research paper and newspaper articles. Case study method has been used for enumerated the data. 6 case studies of use of animal assisted therapy in different mental disorders and setting for promoting mental well-being is reviewed through this paper. I representing 6 case studies in studies. First case study is related with depression, which is a 9-year-old kid with special needs. She had suffered from depression. She was abused by her maternal uncle and she saw his father committed suicide in front of her eyes. She was seeking therapy for trauma. After that, therapy dog was help her to express her emotions. She lost her trust, but after therapy, she felt warm and secure and very happy. Second case study is 8-year-old child who has autism. She found it very difficult to interact with people, and she had very short attention span and could not verbally communicate. But after animal assistant session, her attention span and the concentration was improved and tremendously through activities like playing with pet or walking with him. Here I am also presenting a third case study, which is a 88-year-old female. She had issue with acute neurological changes. She was diagnosed by hemorrhage. Patient had a lack of coordination. She had generalized muscle weakness. That time her family adopted dog and they trained him. Patient was nursing care was ongoing with this treatment phase, and was very this therapy was very impacted, and patient was more improved with her regular treatment also. As we know, petting an animal can cause our brain to release chemical called endorphin. Animal assisted therapy is a goal-directed therapy, which is an animal meeting specific criteria is an integral part of treatment process, which is efficient in improving depressive symptoms and also cognitive functioning also in the resident of long-term care facilities with mental illness and day-to-day life events also. Conclusion and a suggestion. Animal assisted therapy used in mental health as a therapeutic way. It is a providing comfort and a helping in reducing the symptoms and actually treating the patients. Animal assisted activities provides the opportunities for motivational, educational, recreational and the therapeutic benefits to enhance the quality of life. Animal assisted therapy serves to be goal-directed therapy in which animal meeting specific criteria is an integral part of treatment process. It can be considered as one of the non-pharmacological management for who are suffering from mental illness. Pet therapy increases social interaction, emotional support, decreases agitated behavior, decreases risk of mental fall, increases quality of life, induces physical activity, promotes daily routine, improves mood, and better nutritional intake in elderly population. It is suggested through this paper the government can promote the mental health setting to adopt animal assisted therapy as an integral part of their therapeutic services. The organization may be facilitated with licensed counselor or social worker. Animals and a social worker or counselor may be trained in animal assisted process. University may launch a Master of Social Work program which specialized in animal assisted social work. Thank you.
Thank you, Amruta. Our next presenter is Shivani Keni, PhD scholar from BITS Pilani.
American humorist George Billing claimed that the dog is the only person on earth that loves you more than he loves himself. And I'm sure all of you will agree to this. Animal and humans have always shared a special bond, and I share my special bond with my dogs, as you can see. Using this special bond, or using the beauty of this special bond, we have a therapy in counseling known as animal assisted therapy. Animal assisted therapy involves animal interaction with patients to help them cope with medical conditions or aid recovery from mental health problems. The therapy dogs interact with people in need, and this interaction is mediated by beautiful unconditional affection and endless care for the person. Now, this therapy was informally practiced for many years in many ways. But formally, first publication was given by Dr. Boris Levinson somewhere around 1964 in his book of Pet Therapy for Child Psychology. AAT, or Animal Assisted Therapy, is an umbrella term which includes many other therapies inside it. Now, AAT has been practiced all over the world, and it has been proven that it is very effective and helping to solve different types of disorder and mental problems. However, the effectiveness or proving AAT in our country, in Indian context, is still lacking and yet to be done. Before I move on to what I did, let's understand why we need to know about AAT. What's the cause and why is it important? Now, as you all know, India is one of the most populated countries in the world. Our population going up to 140 crores. Along with that, it's very sad, but India has largest number of depressed individuals. Suicide rates in India have increased from 10.2 lakhs in 2018 to 12 lakhs in 2021. Adding to this is the unstable ratio of psychologists, of mental health professionals, and people who need mental health professionals. Ratio of psychologists is 0.03 to 1 lakh Indians, and ratio of psychiatrists is 0.2 psychiatrists to 1 lakh Indians. Moreover, mental health, or the word psychology itself, is a big taboo in a country like India. Hence, there is lack of acceptance towards traditional psychotherapies or the common therapies which most of the therapists practice in India. Now, in this scenario, an alternate therapy like animal-assisted therapy or using animal-assisted therapy as a complementary therapy would definitely help us in bridge the infrastructural mental health crisis or bridge the mental health crisis which we are experiencing right now in India. So to understand this, objective of my narrative review is to evaluate the effectiveness of AAT through reviews of current literature in India and to understand the application of AAT in India, also to review the scope of AAT in Indian context. From my research, this is somehow I could summarize in the tabulated column. Majority of the studies are done on children, especially the children with autism spectrum disorder. Along with that, other development disorders as well. Apart from this, studies are also conducted on adolescents, that is again autism and mentally challenged, adults in office settings, stress reduction, or even in suicide prevention, and in old age, palliative care and geriatric needs. Again, majority of research is only conducted in hospital or rehabilitation centers. Now, this brings me to the current status of AAT in India. There is definitely a lack of awareness about AAT among general population, professional, and researchers. Even among the studies which are conducted, there is a lot of research gap, which is small sample size, lack of randomization, absence of control group. There is lack of data and lack of diversity when the studies are conducted. Moreover, there is a lack of regulatory government policy, a government organization which would see the ethical implementation of AAT. Now, this brings me to the scope of AAT in India. Studies have shown that there are around 6 lakh pets which are adopted every year by Indians. More and more Indians are choosing to be a pet parent than a human parent, which in well shows that there is an acceptance of animal and pets. As ma'am already spoke about this, Animal Angels Foundation in Pune is well established and doing very well in Mumbai and in Bangalore as well. So having more centers, their center only, in our Goa or other parts of India would definitely promote AAT. Application of AAT is not only restricted to mental health, also occupational therapy, social work, and physiotherapy. Hence, I believe AAT is a promising area, but there is need for intervention-based research and researches. We could have courses of AAT, institutionalized AAT. One point I would like to make is that we do not only need the exclusive dogs to make them a therapeutic dogs or therapy dogs or animals. Our indie dogs, our stray dogs are equally affectionate and caring, and I'm sure all of you will agree to this. They could also be used. Using stray dogs would give them rehabilitation, would give them a home, and it will reduce the human-animal conflict which we experience in the urban society. Thank you.
Thank you, Shivani. Our next presenter is Klizma Anyuska Da Costa, who is the college counselor and researcher at the Rosary College of Arts and Commerce, Goa.
Good afternoon, everyone. This study is titled Emotional Intelligence and Values, a comparative study among children in Goa with and without engagement in expressive arts. This paper is co-written by Tanya Kenny and I'm Klizma Da Costa. In this study, we have 3 variables, out of which 2 are dependent variables, which is EI, emotional intelligence, which is specifically trait emotional intelligence, and values. And the independent variable we have is expressive arts. The aim of the study was to explore the relationship between emotional intelligence and values among children in Goa who engage in expressive arts and those who don't. The objective of the studies were to compare the trait EI and value scores between children with and without engagement in expressive arts, to study the correlationship between trait EI and values among children with and without engagement in expressive arts, and to understand the demographic predictors of trait EI and value scores for all children. The hypotheses were as follows. There will be a significant difference in emotional intelligence and values in children who engage and don't engage in expressive arts. And hypothesis 3 was there will be significant correlationship between emotional intelligence and values in children. For the sampling size, we had a sample of 617 students in total. The age group was from 8 years to 12 years of age, out of which females were 350 and male children were 267. In the control group, we had 283 children, and in the experimental group, we had 335 students. Convenient sampling method was used. For data collection, I had to approach different schools in Goa, asking the principal to give me permission to send this Google form across to different students. Thereafter, the teachers were involved and the link was shared with the parents. The parent had to formally consent before the child participates in the study. We used three tools for data collection. One was a self-designed demographic sheet. The second one was a trait emotional intelligence questionnaire. And the third one was portrait value short questionnaire. Under the portrait value short questionnaire, We had 4 domains. The first one was openness to change, conservation, self-transcendence, and self-enhancement. The tools used for statistical analysis were a t-test used for hypothesis 1 and 2. For hypothesis 3, we computed Pearson's R coefficient, and for demographic factors were predicted using a regression analysis. The results were as follows. Children engaging in expressive arts showed significantly higher emotion intelligence, thus confirming the first hypothesis. For the hypothesis 2, it was partially confirmed, where we saw that children had a significantly higher openness to change the value. At the same time, they were lower in conservation and self-enhancement when it came to children engaging in expressive arts. There was no significant difference in values dimensions of self-transcendence in both these groups. For hypothesis, for hypothesis 3, we had in children engaging in expressive arts, only openness to change is seen to be significantly related to emotion intelligence, which indicates that higher openness to change has with increasing emotional intelligence. In the demographic variables which predict emotion intelligence and values in children, we saw that children who have had lower age showed higher emotion intelligence and values, higher emotion intelligence, and in values, openness to change and self-transcendence was seen higher in the female child compared to the male child, and self-enhancement and conservation was seen to be higher in male child. Now the limitations and directions for future research are, this study could be done with other age groups in future to understand developmentally how engaging in expressive arts can impact emotion intelligence and values. The sample is limited to Goa, so we cannot make broad generalization. The same study can be done in much more controlled setup with higher experimental rigor. And we could also explore other variables such as psychological well-being, self-concept, psychopathology, impulse control, achievement, and etc. To conclude, we saw a positive relationship. There is a need to incorporate expressive art techniques and intervention in education and counseling practices where it is not integrated yet. Considering demographic variables in designing intervention is very important when we plan interventions. And last but not the least, both these variables, values and EI, can be implemented in an intervention separately because there was very weak correlation between, a weak connection between both these variables. My references, and thank you.
So our title of the study was Healing Through Art, a qualitative study on at-risk adolescents. So the aim of the study was to find out the impact of various art modalities on the behavior of at-risk adolescents. The behavior, we wanted to see if there are any changes in the 3 therapeutic domains: mindfulness, expression, and group interaction. So the case study method was adopted, and they were directly observed. Participants were 6 girls, ranging from 14 to 17 years of age. And the study was done in childcare institution, Bal Kalyan Nagari, Mumbai, and 35 discussions were held. So the reason to select these participants was that they are more prone to mental health issues during that age. We call that stress and storm stage. And some of them were newly rescued also, and most of them were isolated. Like, they were not going to school, so there was no exposure to outside, and they were only taken out for their court trials. Research tools used were direct observation through session recording scale, neutral observer checklist. The caretakers were given checklist. Aggression questionnaire was administered by their in-house psychologist. And ABT tools used were 6 PSM and emotional heart album. So the procedure was something like this. Like, The sessions were of 1 hour duration, and like a therapeutic domain was selected. Okay, whether it is mindfulness or whether it is group interaction. So in the first example, there was interaction with the caretaker, and the facilitator saw what is the need of that day. So based on that, therapeutic domain was selected. A metaphor was the theme for that session. Communion was a ritual that was followed for every session, that is coming together, holding hands in a circle and welcoming all the participants. And communion, there was a warm-up activity also in that, which was related to creation. That is the main activity. For example, when we took visual arts, they were given some activity to draw or paint. And closure was the group shared how they felt, what are their thoughts, what are their feelings. And they also shared their thoughts. Also, group interaction was one more domain. Whenever a music therapy was introduced, sessions were held. So that time some warm-up activity was done, repeating vowels or making some animal sounds, and then giving them some instruments to play, making their own beats, and then closure was competing with each other. There was a competition between the groups. So this is one case study out of 6. This girl, pre-intervention, she was not ready to complete the story. And post-intervention, she did not get up till she completed the story. And you can see achievement, friendship in the story post-intervention. In pre-intervention, she was asked what she has in her heart. She wrote Udasi, Gussa, and the red color, it also signifies that anger she had in her, for her family. And then post-intervention, she said she wants to bloom like that flower. And she expressed herself in few lines, wherein she said that how was she when she joined the institution and how is she now? Like she has made friends and all. Also, if you see these patterns, this activity of all the 6 participants, they are not very interested in the first, they have just scribbled, and in that post-intervention, the patterns are very clear and mindfully painted, drawn. We saw increase in mindfulness and group interaction, but there was not much increase in expression. This was mainly, we believe that it was because they were very hesitant and shy to participate, and art therapy was very new to them. Okay, so they were never introduced, they never did this drama and music therapy, they never participated. So it was very new and they were very shy, hesitant. The implications for this counseling practice is it can be replicated in any part of the world, can be shared with teachers, parents. There is no expensive art material needed for this. You can extract paints from nature, turmeric, soil, and even the instruments, musical instruments, you can use buckets or, something like that. So, thank you.
Our research is titled Play Works, a Therapeutic Approach to Play. So education and therapy have something in common. Both are at the service of helping people become better versions of themselves. And if therapy is integrated into education, we can achieve holistic well-being, because to heal is to become more whole, more learned. As the famous psychologist Jean Piaget said, play is the work of childhood. That means as work is for an adult, that is the importance of play in a child's life. And it not only has advantages for brain development, but also aids in holistic development of children. In counseling, the value of play has been harnessed for its therapeutic benefits, as is seen in play therapy, which is a counseling technique. In preschool, we have a similar practice called free play. Free play is where the teacher sets up the classroom with different materials for play. And so this is an unstructured environment. And the play is child initiated because the child gets to choose their play material according to their need. So this is cathartic, therapeutic, and also growth oriented, and it helps in tertiary prevention of future challenges because it helps in dissipating any issues the child is facing before it becomes too large where it would require therapy. Therefore, we did a very brief study to ascertain if free play was being practiced in preschools in Goa, to understand the nature and frequency of this free play, to obtain insights of the preschool teachers about the benefits of free play, and to provide suggestions, if any. We used mixed methods, so we had a quantitative aspect which we analyzed with frequencies and percentages, and we had a qualitative dimension for which we used theme extraction and thick descriptions. We had 42 preschool teachers from 36 preschools. Most of them were from private schools, and most of them taught in upper KG. The key finding was that only 26% of the teachers who participated reported that free play is permitted in their preschools every day for either 15 to 30 minutes or 30 to 45 minutes. So free play requires a little more time, so 30 to 45 minutes is what is suggested. And with a variety of materials, as you can see below in the slide, those are the different materials offered during free play. Several others responded that they had free play in their preschool, but when we analyzed the responses further for the details of free play, we realized that what they practiced was not free play, but rather free time soap play, and only on some days with teacher directed or chosen material, usually of only one kind, so like only art and craft or only outdoor play, and sometimes this was related to the lesson taught, so it was more like a follow-up for the lesson. We asked them if they saw any benefits for free play. So almost all, even those who didn't have or who said they didn't have free play in their preschools, they believe that free play had numerous benefits for children, as you can see in the themes that we extracted with a few illustrations. So I'd just like to mention self-development or self-expression and emotional development, which is something that which is related to therapy. Here are some thick descriptions or their verbatim responses of some teachers. I'll just read out one because of time. Children can decide what they want to play with, which will help them in decision making later. It also helps children because they get to explore what's in their mind. We asked them if they had any other comments. So a few teachers mentioned that the concept of free play was still not clear to many teachers, as we ourselves noticed from their responses, like they were very confused about what free play was. So we have some of their verbatim responses there. And also some of them were very grateful for the knowledge they had received about what was free play when they did their preschool teacher training course that the researchers have been involved in the past. These are our recommendations, that we need to create awareness of the concept of free play and its benefits, especially for emotional and self-development or for expression for children. And we suggest that free play should be at the beginning of every school day for a minimum of 35 to 45 minutes, because we do not know what environments children are coming from, their home environments, or even just the morning rush, eat, run, catch the bus till you reach there. So like they come very stressed out. So when they come to this free play environment, they just get to do what they want to do. So like they are in control, and then they are ready to give the teacher the control. So to conclude, I would just like to say that free play helps a child unload their baggage before it becomes too heavy for them to carry. Thank you.
All work and no play makes Jack a dull boy. Pilot research on Tenacoid, the ring game and its effectiveness in special education. To begin with, let me introduce what the game is, the Tenacoid game. It is a game played with circular rubber ring, Tenacoid material, which involves two teams opposing each other with endeavoring to catch and return the hurdle ring into the opponent's court by knocking the opponent off. All children benefit with play. However, children with special needs require selected games to get them engaged and participate in it. So there's a reference there. This game has a multiple advantage on children with special needs and can change their behavior drastically, thus reducing the undesirable behavior like lethargy, absenteeism, and improve the desired behavior required. The objectives of this study, this is a preliminary study and it's carried out to prove the hypothesis that a selected game like Tenocoid can benefit children of the age group of 14 to 18 with special needs, specifically slow learners, in the following ways. The three main objectives were academic development, that is, the improves academic development, improves attendance as children feel engaged and are eager to participate, builds up self-confidence, social skills, and overall well-being of the child. The methodology used, students of the age group of 14 to 18 years were used for this pilot project. The pre-study, that is the control group, children were assessed with respect to their academic performance, attendance, and overall confidence. Post-study, that is when the test was conducted, they were divided into two groups, A and B. The A group was not allowed to participate in the game and kept seated in class, while the group B played for an hour daily for a month. Then there was a comparative study done between both the groups, and the results showed that in the first internal exams, when it was recorded, their attendance was recorded and the confidence level was observed to the record sheet of the students. Observation and results, it is done in the form of a graph. So the three goals, basically the three goals, as you can see, the first goal is academic performance. As you can see, pre-study, they had the equal level of marks of the internal exams equally. As per the comparatively, okay, they had equal grades. While post-study, the A group had 40% of the grades, while the B group had 60% of the grades. Attendance comparison, initially both of them lost 2 days in a week, that is a week of 6 days. Initially both had, the absenteeism was 2 days per week. While post-study, they were so discouraged, the group A, that they came only for 2 days, while group B came for all 6 days. And the overall well-being comparison, that's the confidence, was done to a record sheet. It was shown that the group B performed higher comparatively, they were more confident, their gait improved, their well-being was better than the group A. In conclusion, group A versus the group B, that was the result I'll be comparing. Performed badly in the first internal exams, 40%. Performed comparatively better first internal exam, that was 60%. They stayed absent, that was 2 days out of 6 days. Attendance improved 6 out of 6 days. They were present. Lacked enthusiasm, physically awareness improved, didn't improve, sorry. Lacked confidence, lacked interest, as well as the social skills. While the group B improved in teamwork, confidence, physical awareness, concentration increased attention span, and their social skills also improved. With addition to whatever the aims were, the eye-hand coordination needed improvement in A, while in B, the eye-hand coordination improved. Physical play, to conclude, physical play can enhance a child's awareness of his body, build and endurance. More than participating in sports activity can do a lot with the child's psyche. And last, thank you. These are the acknowledgements.
My study is a study of personality traits between a sports person and non-sports person. Why did I choose this topic? Being from the physical education field and being a sports director, I always had my colleagues come up to me and tell me about my sports people, like the sportsmen and the women, that they are very active, they are very helpful, they answer in class, even though it may be wrong, they have the guts to answer in class. But whereas they would tell about the other students that they are very good at academics, they would write well, but they would often not come up, not give answers. They would feel shy, they would be alone. So these are the things that I hear normally. Also, I work in a college where I don't have a lot of sports people, maybe 5 sportsmen, and then I have to call and motivate the others who have never played sports in their life to come and play sports, maybe another 5 or 10. So the non-sports people also, I have to sometimes get them and to play sports to make a team. So after they playing sports, me teaching them sports and they participating, often I hear the same colleagues tell me about the same students that in the first semester or last year they were different. Now they have changed. Now they have come out and they participate, they answer, they try to do things. So this made me curious because I didn't know why this was happening because I'm not an expert in psychology, so I didn't know why this was happening. So I wanted to know. So I read and some things, and I came up with an idea that I want to know about the personality. So the questions that came to my mind were: do sports people have a better personality? Can sports help in developing personality? Or can sports and games be used as a way to improve personality traits? So what I did was, I had a small study wherein I used a descriptive comparative method where I compared the sports people and the non-sports people. I used a purposive sampling technique, and I chose 80 students from the college, that is 40 sports people and 40 non-sportsmen, and in that male 20 and female 20. So the tool that I used for data collection was Big 5 inventory, which had 44 items in it, and it measured extraversion, agreeableness, consciousness, neuroticism, and openness. And the statistical tool that I used was, I used descriptive study also, and to find the significance I used independent sample t-test. So here I found out that the sports person, they were better in all, extraversion, agreeableness, consciousness, neuroticism was less in sports people than the non-sports people. Openness was higher, and overall personality somehow also was higher. Okay, but what I found was there was a difference, but the significant difference was only found in 3, that is agreeableness, conscientiousness, and overall personality. The others showed a difference, they were better, but it was not very significant. And this is what I found. So from what I found, I would say that I also observed that in sports, when it comes to sports, in India especially, we have 2 extremes. One is, we say that sports, those people who play sports, they waste their time. That is one extreme. And the second extreme is that we only think about medals and winning at a national level and all those things. We never think about sports for the common man, the common people, and we never think of sports in this way, as a therapy, or maybe to build life skills of people so that they can develop their personalities and all. So I would say from this study and my observations also, I found out that sports does help people to develop their life skills, in which in turn may be helping them to develop their personalities in various ways. So that's it. Thank you.
My study title is Experiences of Participants Practicing Anapanasati Progressive Relaxation via Breathing Technique prior to counseling sessions. Indian mental health fabric is vulnerable to many challenges and hurdles. Stereotypes around psychotherapy and counseling are still very prevalent among the middle class and lower middle class section of the community, especially in the Indian population. According to this study, client experience is significant in understanding how the therapy is working and effective. The client, Elliott 2008, approaches to improve heart rate variability and reduce stress, such as breathing retraining, are more frequently being integrated into psychotherapy, but little research on the effectiveness has been done to date. Methodology. This is qualitative study aims to explore the experimental differences in the participants during the counseling session. Sample for the group was selected using non-random purposive and convenience sampling. Sample was purposefully selected with the same socioeconomic background, that is middle class household, age range 18 to 30 years old, and with fair medical history. There were two groups in the study, number 10 each. Group 1 practiced Anapanasati, the breathing technique prior to the start of the counseling session, while group 2 did not practice any relaxation interventions prior to the counseling session. Anapanasati is the part of meditation vipassana, and Anapanasati is the name of came from Pali language. The Anapanasati activity was conducted with the client in the sitting upright position and guided to perform the breathing activity for duration of 5 minutes. The semi-structured interviews were conducted post the counseling session by a counseling training. Samples characteristics. The mean age of participants, number 20, was found to be 25.76 years of age, and the sample consisted of 14 males and 6 females. One-on-one interviews were conducted to understand the experience of participants in the counseling sessions. The data was assessed by coding the eventually forming themes from the narrative of the interviews collected, Brown and Clark, 2006. The interviews transcripts was read repeatedly in order to obtain an overall picture of the client's experiences. Then the significant statement relating to the experiences of the client was highlighted. This process obtained an overall picture of the client's experiences, and extracting and significant statements was performed with each of the research participants' transcripts. And this is the result. These are the following themes. Theme 1, 2, 3, and 4. Venting out, feeling cathartic. Second, bodily relaxation and mental calmness. And third one is intensive and overwhelming. And fourth one is recreational activity. Summary of theme. The tabloid format, group-wise based on the frequency they appeared. Group 1 and Group 2. Group 1 is with breathing exercise, and Group 2 is without breathing exercise. Relax, very frequent, Group 1. Recreational activity, moderate frequently, and venting out, cathartic, less frequent. And Group 2, vention out, cathartic, very frequent, intensive, moderately frequent, and relax, less frequent. And our discussion is the qualitative study conducted on number 20 participants revealed the difference in the experiences of the participants. Addiction of the Anapanasati activity resulted in the more relaxed experience of the participants in the counseling session. The major theme which emerged from the data collection part of the study were related on their frequency of appearance, and it was observed that the Group 2 with no breathing exercise experienced more intensive perception of the counseling session. Two, there is less evidence of using breathing exercise just prior to counseling. Studies like this are just the starting point of further detailed investigation with protocol-based experimentations. Mental health counseling or any other mental health or care input can be perceived as stressful, mentally taxing, executive, and such a breathing exercise bridge the gap of reduced relaxation from such perception. And this is our reference. Thank you very much.
So as you can see from the title, I'll be discussing about the professionalism in counseling practice, perception of budding psychologists. Till whatever papers we have heard so far, everything was looking at the positive, flourishing, all aspects of this. So this presentation, I think, will take you or will make you pause for a moment to think about and reflect whether whatever we are doing now, are we doing it properly and adequately, and what all changes we need to make. So this is some theoretical part which everybody will be familiar. The first part is about what are the professional ethics, and counseling is a professional relationship. What are the points listed by American Counseling Association, etc. moving on to my presentation. This study examines the perception of budding psychologists about the professionalism followed in counseling practice. So participants included 35 psychology students who are pursuing post-graduation in Kerala. So what I did was I asked the participants to write in as much detail as possible about the counseling experience they have had, or to report the experience. See, many of them came to me, and not many of them, like 3-4 of them came to me and said, ma'am, I have not had any first-hand experience. So I said, if you can talk to a significant other who can give you in as much detail, you can consider their case as well. So the data was collected in this way. Either it was based on their own first-hand experience, or it was based on the experience of a significant other, and thematic analysis was used. So nature of issues for which help was sought mostly fell into these categories, that is family, marriage, academic issues, relationship issues, affair breakup, etc., etc. The positive aspects we all are familiar, like, the good listening, understanding nature. We can see a huge list of points. These are mostly taken from the verbatim as such. So we can see so many things. Like, one interesting thing I found is one person has said the counselor as a mirror of the client, down to earth, empathetic is very common. We always see in textbooks as well. So the other points, the next aspect was the temporal aspect, which related to the length of the session. And the client also reported, if we had a pre-planning about how much time is available, it was easy to fine-tune the, what to speak first and things of that sort. Confidentiality, emotional support, etc. are also there. Then counseling setting also becomes an important factor. About the counseling experience, these are some of the verbatim reports. So some people said it was a self-discovery journey. I felt stronger. I experienced better sense of control in decision making, which I wish to strengthen. It was not a simple talk therapy. I've got to look about a better side of myself, etc. And the last point, the fact that counselor listened to me and empathized with me, like not even a friend would have, was something that told me I would see better days soon. So these are some of the positive aspects that came. But looking at the negative aspects. So what are the points which came from this data? So the counselors had a patronizing nature. Not every counselor. From the set of data, we saw people with patronizing nature, some were judgmental, non-empathetic, poor probing skills, etc., etc. And then one person also reported, counselor, when I told my problem, the counselor just said, let it go. So if I had the courage to let it go, then why would I be there in the first place? So these were some of the points that were coming to the mind. And in the middle of sessions, counselors were showing tiredness. It made the client feel uncomfortable. And unfortunately, in the middle of some sessions, psychologist was having snacks while conversing with them. It was hard to believe, but students came and told me, ma'am, this actually happened. And similar instances happen more often in the online sessions, online therapeutic sessions, and the clients could see the online counselor browsing phones, checking their WhatsApp because they can hear the beep sound and all. So these things were all happening, and we need to stop and reflect about, this is not criticizing all the counselors, but this is to, make us think about it. Now, what is the actual time that is to be dedicated? So whether it should be a 15 minutes or it should be 5 hours, so there were so many discrepancies in that as well. Emotional side also, so many things, invalidated my emotions, then started to take, the counselor became a very dependent person, and people started dumping everything on them, etc. Setting also was very problematic because staff kept interrupting. Then interns during the process was also another major challenge which the counselees felt. So about counseling experience also, you can see so many verbatim responses. So some reflection which I would ask is to, I would like to bring to your attention is, to whom does the counselor or psychologist hold the primary responsibility to? Need for a standard practice taking into consideration, and lack of feedback to the counselor in cases where clients drop out. That was like a major source of learning that is lacking. Just one point to end, especially in cases where who the primary responsibility hold to. In many cases of inter-religious affairs, the parents bring their children to the counselor saying, we want to break this affair. So here, most of the time, the age of counselor matters. If the age of the counselor is someone somewhat related to the parent, then counselor was more likely empathizing with the parent than the client who is the child. So this is not to criticize. These were based on the data that has come, and these points needs to be reflected in our clinical practice. Thank you.
Title of my paper is National Tele-Mental Health Program, Need and Challenges. COVID-19 pandemic recently revealed that there is a huge burden of mental health issues among people, and people suffered a lot. Research has shown that teleconsultation and telecounseling is effective to provide mental health services among people. Recently, Government of India has introduced the tele-mental health program. Tele-mental health is a telecommunication or video conferencing technology to provide mental health services. It is sometimes referred as telepsychiatry or telepsychology. Government of India, in its Union Budget 2002, announced the National Tele-Mental Health Program in India. Telemanas is the National Tele-Mental Health Program. It stands for Tele-Mental Health Assistance and Tele-Networking across the states. It is the digital arm of District Mental Health Program. Objectives of Tele-Mental Health Program is to provide universal access to equitable, accessible, affordable and quality mental health care, to exponentially scale up the reach of mental health services to anybody who reaches out across India anytime, to implement full-fledged mental health services network, to extend services to vulnerable groups of the population and difficult to reach population. The organizational structure and calling mechanism of Telemanas is NIMANS will work as an Apex Nodal Institute. 5 regional coordinating centers will be there. 23 mentoring institutes, including NIMANS, and 33 Telemanas cells are working. The calling mechanism is caller dials Telemanas, and they can connect with IVRS-based system helpline number to counselors and mental health specialists. And in-person services, in case of in-person services, patient will be referred to tertiary mental health care institute. Research methodology. Objectives of the study was to review the salient features of Telemanas, to study the needs and challenges in implementation of telepsychiatry. Methodology. The current paper is based on secondary data compiled from government portals. The need for Telemanas and its potential benefits. Need for Telemanas is over 11 crore individuals in India suffer from mental health disorders, and 80% of among them don't seek any mental health care facilities. Over 1 lakh people end their life by suicide every year. For every suicide, 20 other people attempt to end their lives. The potential benefits of Telemanas is it is convenient, broader to reach, very few barriers are there, and recent advances we can use in technology. Challenges in front of Telemanas is access to technology, quality issues people can face. It requires to invest money. Cost will be means many people cannot afford to buy instruments. Privacy issues can face necessary skills required by service provider and the person getting help to use technology. Necessary investment is required. Regular evaluation to assess efficacy of the program is required. The beneficiaries of Telemanas in Goa state will be person dealing with depression, anxiety and stress, victims of domestic violence, women in distress, people facing problems associated with addiction, children needing care and protection, elders facing abuse, transgenders, student population, suicide victims, mental health first aid, mental health promotion, mental health issues in COVID-19 pandemic, people in need of rehabilitation services, and benefit schemes in mental health care. Scope for convergence of the Telemanas with other departments. Telemanas will work with police departments, women and child development departments, education departments, health departments, rural development departments, and social welfare departments, and universities and colleges. Mental health facilities in the state of Goa. Institute of Psychiatry and Human Behavior, Bambolim, Goa, is a tertiary mental health care institute which provides psychiatric inpatient and outpatient services, assignment services, casualty services, and many other services. Recently, Telemanas program is introduced in Goa state. In South Goa, Hospicio Hospital will be the center of Telemanas, and in North Goa, Institute of Psychiatry and Human Behavior will be the center for Telemanas. The staffing pattern will be, there will be senior consultant psychiatrist, clinical psychologist, psychiatric social worker, psychiatric nurse, counselor, project coordinator, data entry operator, and attendant.
The paper that I'm presenting is titled Community Counseling, A Need of the Hour, a Conceptual Framework. So community counseling is a topic that I've chosen, is a theme for my paper presentation. We all know that the counseling services happen in two settings. One is medical setting and one is community setting. Medical setting is where a counselor or a mental health professional provides therapies and interventions in a medical setting along with other professionals like a psychiatrist, a psychologist, or other doctors. And community counseling is where a counselor visits the community or the society where people are living and help them with their psychosocial problems that people have. And here the people don't have to travel to a different place, whereas the counselor comes to their vicinity. According to Eric Johnson, community counseling is a form of counseling in which different counselors work with families, individuals, couples, and also communities in one or the other way. Community counseling is generally conducted to prevent a problem and assist in setting prevention programs in different communities. The objective of my study is to highlight the need of community counseling, especially in Goa, and to understand its importance in the community or social psychology, which is used as a theoretical approach that focuses on the relationship and interactions between individuals and their social context. The need for community counseling. The focus of community counseling should be on the understanding of the psychosocial problems of the target community and provide solution to these problems based on the local knowledge of the social issue. Community counseling is about providing psychological and social support in the form of interventions and activities at different levels of interactions, whether individual level, family level, organizational level, or institutional level. Community counseling helps in understanding the need of community as a whole. The community counselor can work in collaboration with other stakeholders to formulate an intervention plan for the upliftment of the community they are working. For example, many migrant or rural communities are unaware of the benefits they have because of the lack of knowledge and education, and they are unaware of their rights and privileges and are often exploited. Another major issue with communities, with these type of communities, that's marginalized communities, is that of employability or career guidance, as many of the youth there are unaware and ignorant of the many ways of building their careers. So awareness programs on promotion of healthy lifestyle and how to prevent the spread of infectious diseases and maintaining healthy lifestyle for overall physical and mental health can be some of the activities that can be taken up by the community counselor. Approaches to community counseling. In a study conducted in 2007 by Lazarus, he highlights the following as the key values of community counseling, which are addressing any form of oppression, prevention and health promotion, promoting sense of community, emphasizing cultural relativity and diversity, which can be adopted by the community counselor while working in these settings. Also, the two disciplines that are closely related to community counseling are psychology and sociology, and intervention plans can be formulated on the principles of these disciplines. However, the approach to community counseling will depend on the issue that the counselor is handling at that moment. Apart from these two disciplines, other disciplines that the community counselor can use are cross-cultural studies, history, public health, and education. Community counseling roles and practices. The role of a community counselor will depend on the community they are working with. Few general practices that the community counselor can adopt are creating awareness about prevention and protection and understanding diagnosis of diseases, especially diseases like HIV, AIDS, hepatitis, sexually transmitted diseases, etc. Promote maintenance of healthy lifestyle, ill effects of drug use, de-addiction programs, intervention to attain emotional and mental well-being, career guidance and skill development, rural development programs, etc. The community counselor can work in collaboration with organizations like law enforcement agencies, consultancy agencies, recruitment agencies, and NGOs to help people. So the role of the community counselor will not be confined to that of only a mental health professional, but will be a dynamic role based on the issue at hand. They will have to play the role of an advisor, advocacy officer, community development activist, social worker, along with being a mental health professional. And lastly, for my conclusion, the focus of this paper has been on the importance of community counseling, the role of a counselor, and the interventions and assessments that could be used. Further research has to be conducted on how this can be put to practice. Thank you.
As the topic was already told you, what I'm going to talk about is the counseling skill. Here I want to remind you, because I don't belong to actually directly to the field of counseling. I teach human development faculty of home science. So these are the things which I want to inculcate in my students who are doing MSc human development, and they specialize in guidance and counseling. So what I'm trying to, so this is not for psychologists. I know you people know more than us. So being a home scientist, I want them to learn and practice again and again how they are going to interpret what the client is trying to say, and especially what is the beauty behind this. They need to practice is restatement and paraphrasing. That becomes difficult as per the, I don't remember the name, the practicing counselor, amateur people, because they find it maybe somewhere they are getting restrained, or they may not be helping the client what they are trying to interpret. So the stories, because client story may be complex for them, and especially so what they need to understand is trying to reflect the elegance with the elegance what the client is trying to say. And one more thing about this, being introspective and insight learning also there for the client and the counselor as well. So they need to practice it again and again. And one more thing, because this has happened to me, I have never been outside my classrooms. When I graduated, I just started teaching, and I'm teaching for more than 25 years. I never got the opportunity to learn what I was learning through the books. So I tried and learned the hypnotherapy from the people who actually work in the field. I have been the student of, maybe you may know his name, Sam Manikan sir, and he has taught me the Gestalt therapy. So this is the beauty about the dream, because most of the psychology people, I don't know much about them, but because I have good friends, they are still afraid of practicing hypnotherapy. I know that is costly, another thing, but as a skill in between some kind of intervention, dreams are actually used. And I have seen the beauty of the Gestalt and this Jungian psychologist who say that dreams can be and should be incorporated as the interpretation of the ideas. So this is for the youngsters to learn. And one more thing, I know, I don't know why it is going over, the poetry, metaphor and stories and humor. As we all know, metaphors are the commonest thing which we are using right now. And the beauty of poetry, so explanation we have as the inner self that can be interpreted, and especially the use of stories, we all know about the biblio-counseling. So that is the beauty, and that skill should be incorporated. And I'm not going into the detail here. But the basic thing is, you all know that the use of expressive art, and I need to stop here. Let me remind you the most about the humorous shows we see on the Sarabhai and Sarabhai in the Hindi belt Kapil Sharma show, that is quite popular. So humor is being the cathartic, we know. That is the skill we should also incorporate as we are doing the counseling. And use of expressive art, I know you people know more than about these things. So especially the dance and movement art, and I know certain therapists, they are actually doing good things in Delhi NCR by using dance and movement therapy, even with the older adult like us. So that is fabulous, and we know that these things can be incorporated. Music, we all know music therapy is a long and very touching therapy. Even the medical people who never believed in the musical instrument, they are now believing with that, and they are still believing with the dawa and dua, the thing, and the musical thing. So we all know. And visual arts, we know, seeing things, creating things, we know that create certain things. The test, TAT and CAT, all are based on the visual perceptions. So that is the thing, especially the new counselor should learn. And they practice about that. Sand play, we all know the beauty of the play therapy. Maybe the play therapist, as play therapists, they cannot practice without the licensing, but nobody can stop them using sand play in their own counseling session. So this is one of my suggestions, and this is the most beautiful thing which we have seen in ECE centers as well. Now the basic thing which I want to say here is philosophical counseling. We all know as we grow up, we all become a group member of any religious, spiritual psychological group or some social groups, where we want to learn about, I'm not talking about this philosophical counseling, the original the philosophy people were claiming, but what I'm trying to say is the spirituality and some certain other things can help, and if we try and inculcate some kind of connection between that can be miraculous. And the most important thing, which we have already seen in colleges, we have been in national service scheme and other volunteer works, and that has not only given them the certificate or some credits for the admissions. The being a volunteer in something strengthen the thing. I need to talk about this. If we involve the client in the community service, that can do so many things. The social action, especially they help people, and this kind of especially the interventions were done in Western countries. We know that if they are down with some kind of against the law or something, they do go for social services. I don't know that in India whether we are practicing it or not. So that is the good thing, and thank you so much.
So my research is about deciphering the meaning of calling by healthcare professionals using a qualitative inquiry. Now, just to give you some context to what is calling, I'm not talking about the phone calling, but I'm talking about vocational calling. So when we speak of vocational calling, we are talking about how do we feel called towards the work that we do? And I wanted to understand that for healthcare professionals. So we spend a lot of time at work, and the meaning that we draw from work kind of translates to meaning in life as well. So that was something that I've always been fascinated with. I chose psychology, then I moved into the corporate, and then I was like, okay, this is not my calling, I need to get back to psychology. And I've also seen people who pursue their career in engineering and IT, and they work there for years, and then they decide that this is not something they've wanted to do. So that was something that I really wanted to get into and understand. So when we're looking at vocational calling, we're talking about someone who may show interest, someone who may be passionate about a particular field, or someone who wants to give back to the community, or it could be somewhere between profession as well as vocation. So understanding that gap for healthcare professionals is something that I wanted to get into. So if we go further into calling, there is a religious view and a secular view. A secular view is something that we all see in more of individualistic societies, and religious view is something that we see a lot in Christianity, where I had a participant who said that I have been put here by God. It is a calling by a higher purpose, by a divine influence. So it's not work that you're doing for your own benefit or your personal fulfillment, but it is something that you feel that you've been called or you've been put over here to do or kind of continue God's message that has come to you. And I wanted to understand that in the Indian subcontext. How do people see vocational calling? Is it secular? Is it religious? Is it something of both? So the gap that we see is that work in the career counseling field, when someone comes in for understanding which career they want to pursue or which subject they want to choose, we look at aptitude, we look at interest, we look at personality. How often do counselors actually question the client about what's your calling? How do we measure what calling is? What is the qualitative and quantitative aspect of understanding what calling can be? So this was where the gap was, and also the study that had been conducted was, majority of it was done in the Western population. So I wanted to see what it would mean like in the Indian subcontext. So the aim was this study uses a qualitative inquiry to understand the lived experiences of healthcare professionals who are actually living calling at work. So I'm not seeing the presence of calling, I'm seeing healthcare professionals who are actually living their calling. And the objectives were how healthcare professionals understand the phenomena of calling in the Indian subcontext and study the journey of the healthcare professionals. So the method was that It was a qualitative study, phenomenological approach was used, a semi-structured interview was drafted, and the data was analyzed using Braun and Clark's approach. And the sample that I had filtered down to was with the help of the living calling scale. And only those clients who said that they were living their calling were finally finalized for my study. And out of that, we had 17 participants in the age range from 27 to 58, and 5 were males, 12 were females. And the eligibility criteria I had set was that those who are 25 and above and have a minimum of 5 years of experience. Results were that, there were 2 themes that came out: elements of calling and influences of calling. Elements of calling was how they defined calling. So they saw it as an inner drive, an interest, passion, something they find purposeful and meaningful, and work that they are motivated to do. And influencers was something which was, which kind of was the factor which led to deciding that healthcare profession could be my calling. So it was family pressure that had a role to play, as well as support from them, academic performance, influence from the teachers and peers, as well as personal illness and illness in the family, which led to deciding that healthcare profession is something that they would want to specialize in. So inclination, finding pleasure, meaningfulness, these were factors that fell perfectly with studies that were conducted before, as well as the person-environment fit. And an important factor that really stood out was that family pressure was something that is quite central to the Indian subcontext. Following what the parents have to say, it's part of the moral conduct to listen to what the parents decide for you and your career. So that stood out over here in the research. So implications, as I see it, is that it would fall very well in the healthcare professional, student counseling and career planning. And between understanding what your parents want and what you want, counselors can help bridge that gap to understand what you really want to do and what your parents actually really want you to do. And if you're unwilling to switch the job roles, counselors can also come in over there to understand how close is your current profession to what your calling could be. And limitations were that we do not have an Indian adaptation measurement of the instrument yet, and future direction is understanding the different cultural contexts, how that may influence the expression of calling, as well as studying different jobs and how would people see calling in different job professions. So that brings me towards the very end. Thank you so much.
So the title of my study would be The Psychological Well-Being of Doctors. So now you may ask me, why doctors? So we are quite often aware that most people, like all of us with the advancement in technology and stuff, we have the access to better healthcare, be it physical health or mental health. We all acquire, we see to it that our well-being is in a proper state. So now doctors often, they deny the fact that they are in need of help. So my study was conducted among 300 doctors in Bangalore and Bellary. So while any profession calls for a specific role to be performed, we see that doctors, they tire endlessly in meeting the patient's needs. And often in this journey, there's not a proper balance between their work life as well as their family life. So several studies also support and say that doctors experience severe burnout and emotional exhaustion due to the role that they have to perform. So now the objective of my study is basically to understand the psychological well-being of doctors. And so the comparison is made among different factors, that is how age can impact, age can be a comparison, how gender can be a comparison, the type of hospital they work in, like government hospitals and private hospitals, and the different age ranges like I mentioned. So this is the methodology. Like I said, 300 doctors, 150 covering government 80 covering government and 70 in private for both males and females. So now results. So the first objective was to study the comparison of psychological well-being among male and female doctors. So here it was seen that the mental health of male doctors was found to be much better than that of female doctors. So mental health in my study refers to the emotional and cognitive well-being. And in the second objective, which specifically focused on government doctors, among the 3 different age ranges, young, middle, and late adult male government doctors. So here it was seen that one of the dimensions is life satisfaction. So here again, late adult male government doctors, they had better life satisfaction than the young and the middle. Now we can probably say here that with experience, they have better coping skills and better ways to handle their stress. So the second thing was among the female doctors. So here there were 2 dimensions that stood out, that is sociability and life satisfaction. So in sociability, the middle adult doctors, they had a better sociability skills here. And for life satisfaction, it is seen that the late adult doctors, they had a better life satisfaction. So when we look at the overall well-being of female doctors, again, late adult, So middle adult doctors, they had a very good psychological well-being in comparison to the young and the late. So the next thing is we're going to look at private doctors among the 3 different age ranges. So we may think like private, better facilities and better access to different resources. But here it's seen that the male adult private doctors, they had a slight increase in their life satisfaction than the young and the late. And in view of the overall psychological well-being, the middle adult private doctors, they have a minor increase in comparison to the young and the old. So in both these cases, we see that the middle adult doctors who belong to private hospitals, they have an upper hand in their psychological well-being. And when we look at females, it's often seen that a more stable mental health was seen among the late adult doctors. Again here, with more experience and better understanding as to how to cope with their stress, manage their work-life balance, the females had, late adult females had a better mental health status. So again, when we have to make a comparison between the male and the female doctors, here it was seen that the middle adult male private doctors, they had a better mental health status than the middle adult female private doctors. Now, despite the access to different resources and several opportunities, a woman is often asked to perform several tasks at home as well, which a man may not perform. So thus, this increase can be seen. And then lastly, now in general, male, if you have to make a comparison between male and female doctors across 3 different age ranges, the first dimension that stands out is interpersonal relations. So here it's seen that the young, middle and late, among these 3 age ranges, the late adult doctors, again, they had an upper hand and they had a better interpersonal relationship skills than the middle and the late. So now with regard to overall psychological well-being of young, middle and late doctors, the middle adult male doctors were known to have a better overall psychological well-being. And in case of women, it was seen as to how the late adult doctors, again, they had a better mental health status than the middle and the young. So obviously the young may not have the proper coping skills and all. So this is what we see here. And so in conclusion, I would like to say that it's okay even for doctors to seek for counseling help and advice. And so thus there were different factors that contributed to their psychological well-being being affected. That is the age, the kind of hospital they work in, improper work-life and family balance. Thus, if any interventions were to be given, it's important that they focus on themselves, prioritizing rest for themselves, as well as engaging in accessing counseling services. Thank you.
I would now like to invite our chairperson, Dr. Anuradha Bakshi, to give us her valuable feedback.
So first of all, I want to appreciate and congratulate each of the 14 presenters because,
Thank you.
Indeed, you have put in a lot of effort and put together a presentation, and you have had the courage to present and share it with peers and colleagues here. And some of you have traveled large distances to be here. So, many congratulations. Now, the second thing I would like to comment on is the range of topics across the 14 presentations. So I think we had, although I'm sure that the topics obviously you would have selected well before you knew the schedule of the national conference, but it's so well aligned. I mean, we just had a speaker who's the founder of animal-assisted therapy, and then the first 2 presentations were to do with AAT And all of the presentations are aligned with the theme of the conference. So the choice of topics that each one well, at least almost all of you had was very well aligned with the theme of the conference. So the innovations, best practices, concerns about psychological well-being, issues and concerns to do with the counseling field, all of these have been well represented across the 14 presentations. Now, no doubt there are individual differences from one presenter to another in how comfortable you were presenting, and also there are individual differences in the clarity and the extent of work. So I very much do appreciate all those of you, even if you had not done a primary research study, you went out of your way to do a review, because even the review would have been helpful to each one here listening to you, as well as the process of putting together that review would be excellent for your own self. Many of you have also done primary research, which you have presented today, and ranging from small qualitative studies to pretty extensive quantitative studies with quasi-experimental research design, etc. The 5 minutes that were given to you, I'm sure, was the biggest challenge you had. And I thank you for making the best that you could in 5 minutes. Just some suggestions I do have. Let me see. All right. And I have some more appreciation. Many of you also gave excellent suggestions for policy. And that's very good thinking, because research, even a qualitative review, you can pull out ideas for how policy can be changed, policy and practice. Right. Okay, so going to suggestions. Some of you have not used scientific protocol in acknowledging the source of the ideas, so do go out of your way to do so. If you have missed it out this time, that's okay. We are all, students in the journey of life, and we can all learn, and you have many more opportunities to present. So do use scientific protocol. So some of you definitely have used all scientific protocol, and your review, so some of you maybe because of time have skipped a review of literature if you've done a primary research, but there are others who have included, you may not have been able to explain a lot of that review of literature, but at least you had a slide with a scientific review of literature with the citations. Those of you who were reading and not looking up, you need to do mirror exercise. What is it? Stand in front of a full-length mirror and keep rehearsing, okay, so that you build, and you can do that. You can also capture any friend or any family member, even a pet. We heard about I myself have had a dog throughout my college days. Our beloved, it was a Himalayan terrier called Spicy, and I was very upset because she preferred to sleep with my mom. I was rather keen that the dog sleeps in my bed, but the dog had other ideas, The primacy of self-determination, even the dog had it. So those of you, okay, you may have pets or even a mirror. And mirror exercise is very important, as is talking in front of, capturing your mom, grandmother, whether they understand you or not, just do that. So don't look down and read. Right. Now let me see some other. Shivani, are you here? Is Shivani here? Or has she left? She's not here. Okay, anyway. All right. So anyway, my suggestion to Shivani was that it was a paradox actually, because in one slide she said that if the effectiveness of AAT had not been researched in India, but I think she meant not much research because, and she had just heard the founder of AAT share about her research. But on another slide, she had dental anxiety listed as one of the outcomes which she had included in her review of literature. So, but overall, I must say, if Shivani's friends are there, please inform her. She was an excellent presenter who shared her ideas with a lot of interest. Is Klizma here? Okay, Klizma, that was an excellent study with a very large sample size, 617. It was quasi-experimental. I don't think it was an RCT. Yeah, so it was quasi-experimental. And even with regard to the ethics, I had a suggestion. You got the consent, but when you have children, you need also what is known as assent form, ASSENT.
So ma'am, this study was started in my college where I did my master's. So I got the assent form done from my college back then.
Oh, okay, that's good. You didn't, consent is from the parent and assent is from the child. Because the parent can say yes, the child still has the right to refuse. When we were I was in that National Institute of Mental Health project that I was coordinating in USA. We did massive data collection in elementary schools in USA, and I had a colleague. The parent had said yes, the child said no, and she was cajoling the child. I just pulled her out of the room. I said, one child shares a negative experience, all the school districts will say no to us. Child has the right to say no, regardless of what the parent has agreed to. So assent is very important. So just one suggestion, Klizma, in research we say that hypotheses are supported. So we don't have to say confirmed, etc. or proved. We say they're supported or not supported. But very good findings and a very extensive study with a very large sample size. Is Nikita here? Yeah, Nikita, a small sample size but a very clear illustration of the art activities and very good. One second, it is Nikita Priolkar. Okay, Swarnim. Okay, Swarnim. All right, Swarnim, 6 small sample size, but that's fine. It's a qualitative research. You illustrated the activities very well, and your tabular presentation and graphical presentation was really clear. Then we have our hosts who also presented, Dr. Nadisha Coelho and Ms. Larissa Rodrigues. A very well conceptualized study. The slides were very well made. Findings were important very important findings for policy because, forget about a playway curriculum here. Only 26% was it? Only 26% of the preschool teachers actually were making free play time available to the children, and some of the others it was free time so play. I like that. Free time so play. I've spent a lot of time in elementary schools in USA when I was doing my PhD, And the ECC classrooms are just, I mean, the elementary school classrooms are just absolutely wonderful. I've gone to the best preschools we have in India, but very few come close because the size of the classroom and the group work is individualized. There are learning centers. So suppose a child finishes their maths worksheet, they immediately go to the science table by choice, or they go to the art and craft table or the reading corner, or there's a door to go outdoors and play. And I saw what a difference that made to the children. So we really do value the findings that you have, and please push for policy change. Is Nelly here? Yes. Definitely a good study. The image of that tenocoit could have been put in the slide, or you could have, if it is a small device, you could have carried it. That would have made your presentation more powerful. And did you include the ethics, consent and assent and all that? You didn't present on it, at least. And was there a control group? Yes, sir. Okay, but the consent form was signed by parents? Okay, and the consent form was signed? It was gone to school. Okay, I know, but we are very lucky in India, okay? We are still able to capture our participants and do research. My gosh, it is very complex in industrially advanced countries of the world. To get one child from one school to answer also, the school district superintendent has to agree, and the universities, review board has to agree. To get to a human participant is not simple at all. Very good summary graphs. Okay, is Dr. Elroy? Yes. So I think you was Dr. Elroy back there. Review of literature. By the way, excellent topic and well conceptualized. And the methodological description was very well done. Some suggestions are, the review of literature, I think for time's sake was missing, perhaps because of the 5 minutes. And the methodology section, you used the big five, so you used the NEO, right? But you didn't mention the name of the test, which is NEO, and you didn't mention the test developer's name, which you can mention in any subsequent presentation. And if difference is not significant, we can't say there was a difference. We just have to say that there was no difference. And you have done a t-test, so you can't talk of cause, because you talked about policy that, sports should be taken up to develop these conscientiousness, etc. Because we don't, in a t-test, we don't know the direction of effect. So it could be that conscientiousness is a pre-existing personality trait, and those who are more conscientious, and you had high on overall personality, conscientiousness, and was it openness? Agreeableness. Oh well, if it is team sports, agreeableness is very important because you have to comply. But it could be those who are agreeable, those who are high in conscientiousness, are more likely to opt for these type of team sports. So be careful that you don't, presume that it is a cause-effect relationship. Let me see, Mr. Praveen. Yes, very good topic, excellent topic, because I think we have a lot of rich cultural heritage which needs to, what with mindfulness-based techniques have become so popular from the West. And, we normally just are not so concerned about cultural appropriateness, but other countries get quite hassled if their ideas are appropriated by people from other cultures. But indeed, Vipassana has a lot of techniques which can be integrated with counseling, and so a very novel design and qualitative study. So some link to literature, but you have, for a publication or something, develop a better link to the literatures, yeah, because you need how does this research fit with the existing body of knowledge. Dr. Lakshmi, where are you? There you are. An excellent research indeed. Just some, this was not clear from your presentation, so I have a question. So I have done multiple studies of this kind, and I've not, we and my colleagues have done, so I have come across some negative findings, but not to the extent that you did. So were these encounters with qualified counselors? Because in India, anyone sets up shop and says they are a counselor. You know, I have people with 3 months certificate course with a commerce degree, BCom, followed by 3 months certificate course offered by a non-accredited individual or NGO. Then they say they set up the clinic and say they are a counselor. So were these with master's degree qualified counselors that they?
Yeah, ma'am. So I didn't get time to tell about this thing. So even when I mentioned in my first slide, there were people seeking help for different things. So see, when we say school counselor has certain roles.
No, not necessarily in India that the school counselor is a qualified school counselor. I beg to differ. We have even school counselors could be a trustee who has decided to do charity work. It's not always the case that they are professional counselors.
Ma'am, let me come to my point. So even going to a school counselor means the person might be going with a family issue to a school counselor. Needn't be a completely, academic issue. So there were these kind of things. And the qualifications, whatever is available, most people said they are PG or 1 year diploma in counseling program. So these were the, and whatever, counselors are available in and around us. That is what people are seeking.
Yeah. All I'm saying is when you share such findings and the negatives were very high, we need to be very careful whose the encounter was with which kind of counselors. Because if the counselors are not qualified counselors, we don't want to kill an emerging field by saying that the mental health professionals are ineffective and using wrong practices. So if we want to nurture the field, we surely do research like this, but it should be clear that the research, practice is, the description of practice is of those who have a master's degree. Also, we need to know what was the years of experience of these counselors. And don't mind me, but when you said that the students who didn't have any encounter, you told them to get it from their significant other, that's a big no. That just drops the quality of the research. You cannot do that, because what is that second-hand so it would have been better if the students or you or whoever had an interview schedule, which they then interviewed a friend or someone who had been to a counselor, but that the student became the provider of information doesn't work.
Actually, this study was not done with the purpose of presenting here. This was done. I had collected information on when students came for some discussions. So I found out certain missing links, and I asked students, why don't you just write them?
Yeah, but then the students who said they had not had any encounter with a counselor needed to not be included. See, it's you have now presented it here. there are even young students who are still deciding their life path, whether to take counseling or not. So if we are going to talk about the quality of practice, we have to be very sure quality of whose practice. Obviously, a person with 3-month certificate course with no background in psychology or human development is not going to be able to manage counseling skills with a 3-month course. So just be careful. I saw that, but licensure is a...
So it is like, it's not I'm not saying that this, but these kind of things have happened in certain counseling, and these kind of things are real experiences of what people have had. So
yeah, but then there are two things. You must have collected data. Those which are second-hand should be removed from the data set, and only those which were first-hand experiences should be retained. And of those first-hand experiences, only if the counselor had the right qualifications. Otherwise, that also needs to be trimmed down. The sample size need not be 35. It is okay to have a sample size of 15. We have those who are presented with a sample size of 4 also, I believe, in 6 at least, yeah. I mean, so it doesn't have to be a sample size of 35. So you can sift through that data and just check it, and because this is it, no doubt I'm not saying that negative, nothing negative is happening in the counseling field. Indeed, I will share 2 instances myself, but there was point after point which was negative. So that one of the students in the department who had done a review of child career guidance centers in Mumbai, and I was not the guide, but in the review, when the student had presented a proposal, I had said, please also don't just collect information from the center personnel, also collect information from beneficiaries. So one of the beneficiaries had said that after the intelligence testing, the counselor had told that student or that child who was appearing for 10th standard that you are not capable beyond a mediocre performance in the upcoming board exam, which is absolutely baffling, and it is a grievous harm actually to a child to say that, because test results are not deterministic. They are probabilistic depending on, it's a performance based on current strategies. But it's not a bhavishyavani for at any time. And but anyway, good for the student. The student decided that the student was so upset that, and the student was convinced that he had promise, and he did really well in the exams, and went back and told that counselor, look here what you told me, and look here what I did. That was one example of a negative episode. Another one was shared by one of my colleagues, who is a therapist and a clinical psychologist. So he had a family come from another state and another town, and they were all in awe of their son, and the son was disobedient, didn't have focus, didn't have attention. All right, and so what did the parents say? Oh, but we have to say yes to everything that my son says, because he got 100% on the IQ test. The child had scored 100 on IQ, which we know is average. But the communication, interpretation of the test score, the testing had been done well, but the interpretation of the test score had not been communicated well. So the parents had allowed the child to do anything and everything, and because 100% on IQ test. And so I'm just saying, negative, even in countries like USA, ineffective encounters with counselors are possible, but let us just be careful. Okay, now let me just see, but I do appreciate your efforts, and it's a excellent topic just to be careful because the list was quite long of the negative. Manas study, that is Dr. Bharti Chavan's, then Satish. Yes, excellent topic, secondary data, but very well aligned again with the theme of the conference, and for secondary data, very well managed. Then we have Frida. Yes. So it was even for a review. Your contribution, your original contribution versus gathering information, the two need to be clearer. Okay, so what was the novel contribution was not very clear. It was a little textbooky. Okay, so just see. Ms. Shweta, human development is aligned with counseling, so you can't dismiss and say you psychology people know everything and I don't know anything. Okay, but thank you for your for the efforts made. Nikita, excellent topic. When you said not much is done, actually I've met Ryan Duffy and I've dialogued with him, but later you did in your discussion cite Ryan Duffy. So, but you also in your review of literature said the work had been done largely outside India, which is the case. Excellent ROL, excellent gap analysis, very quality thematic analysis. And just one question that I pose for you is, does everyone who's working, I'm not asking you to answer it, I'm just saying to include it in your publication. You kind of implied that everyone who's working you implied, you didn't say so, has a calling. But calling is something that not everyone experiences because work is not primary for everyone. So for somebody, family they may be working, they may be engaged in paid work, but family life is a higher priority for them than their work, which is to meet their, material needs. So calling is not everyone's cup of tea. So that just, and that last thing about complying with families' demands, that was in conflict with the calling, is it? Because that was... No, but then it cannot be a calling that if my family is telling me and it becomes a calling, is not aligned with what is meant to be a calling. Because a calling is something from deep within. It need not be, it could be secular like you said, need not be religious, but it's not somebody else telling me and that becomes my calling. Yes, so then that needs to be identified, that the concept of calling itself was culturally, different for Indian participants where the family's influence was being viewed as a calling. So, but overall, really an excellent research. The psychological well-being of doctors, Dr. Sujata. Yes, so, where are you? Are you here? Yeah. Yes. Anna, sorry. Dr. Sujata is your guide. Anna. So, good ROL, good rational, very good sample size. You could be a little, your graphs were fine, but you could be a little clearer about the results because perhaps if you can look for other kinds of comparisons with your the data you have collected and not just look at demographics, that would be helpful. I don't know exactly what is the spectrum of data you have collected. I know, but it was, so you had gender, age, and then within that you had government hospitals, private hospitals, so little confusing. But I do agree that women playing multiple roles and not being able to switch off when they not being able to switch off family responsibilities when they're at work, that makes a huge difference. And I think that the first person, I have not missed out on talking to Amruta. She's left? Okay, then let it. But anyway, excellent topic. She did a qualitative review, and very good suggestions for policy. But Amruta, yes, some practice would be helpful for presentation. But topic was excellent, and the suggestions for policy were also excellent. So overall, everyone's done well, and we are looking forward to the research presentations tomorrow, where Dr. Mukta is the chairperson, and then I believe we have to announce the best paper award. No, I said after tomorrow, when Dr. Mukta is the chairperson, thereafter, once everyone has presented. No, we are not at all, we are keeping an open mind, and we look forward to the presentations tomorrow. It's not foreclosed at all. Okay. Thank you so much, and I must congratulate the organizers and Dr. Pai and the convener, Ms. Larissa, and the entire team. I think we've had a really amazing first day. Thank you so much.
It was a very enriching and enlightening session. Dr. Bakshi, thank you so much for your insightful feedback. I definitely learned a lot, and it has definitely added value to this session. Once again, thank you, Dr. Bakshi, all the paper presenters of this session, and all our other participants for your presence and support. We look forward to seeing you tomorrow for another day of learning and fellowship.